Hey, Mr. Jones. My name is Lauren Stewart, and I'm a nursing student at the University of Alabama. So today I see that we are doing a tracheotomy on you, suctioning and everything, just to keep it clean and to get you in a more comfortable situation, breathing-wise and respiratory function-wise. So I'm going to look at your chart and look at the allergies, and I'm going to go over the procedure with you. But I'm going to position my trash can and perform hand hygiene, give you a little privacy just so you can get ready for the procedure. So after giving you a little privacy, what we'll be doing today is a tracheotomy, and so we're going to suction out and clean your tracheotomy that you have that has been placed in your neck. So we are going to clean that out, and hopefully it will improve your respiratory system and its function. So I'm going to verify the order on your patient care order form. I'm going to use two identifiers with just showing or making sure that you are the right patient. So Jaguar Jones, I see that on your wristband. And the medical record number, which is 417-6352, 417-6352. All right. And so I'm just going to verify the order of your patient care order. And it does say here that we are doing a tracheotomy suction and PRM and a routine tracheotomy care unit per protocol. So I'm just going to check your allergies. So it says on here your allergies are penicillin, and it also says in your wristband that your allergies are penicillin. So I'm just going to check the expiration date on my saline, grabbing it by the label. We see that the expiration date is December 2020 or 2022. So we are in good hands with that. And so now I'm just going to gather my equipment. So I have my tracheotomy care kit, my suction catheter tray, a couple of gauze, straw, strap for the tracheotomy, scissors to cut, gloves. I was not given a gown for the PPE or the PPE equipment that you're supposed to wear, so I will not be wearing a gown today. But now I'm just going to raise the bed to a working height. So when raising the bed, I'm just going to lower the side rail, and I'm going to position my patient in a semi-Fowler's position for this procedure. So I don't have my gown, so I'm going to skip that order, and I'm just going to put my mask on. Show you. And now I'm going to put my goggles on. And now I'm going to put on some clean gloves. So before we start, I'm just going to say that a respiratory assessment was completed. And the reason why the patient needs to be suctioned is because there is an abnormal respiratory rate. So the baseline respiratory rate is 12 to 20 breaths per minute. But with the adventitious lung sounds and the nasal secretions, it has caused the patient to have an abnormal respiratory rate. He experiences gurgling, drooling, restlessness, vomit in the mouth, and coughing without clearing the airway for secretions or improving the adventitious lung sounds. So I assessed the vital signs, and signs and symptoms were associated with hypoxia. There was a decreased pulse oximetry, and there is increased pulse and blood pressure. There's apprehension, anxiety. He's having lack of concentration, decreased level of consciousness, irregular heart rate, and there's also a cyanosis, which is a very late sign of hypoxia. So as we can see, he needs to be cleaned with his tracheotomy. So what I'm going to do with the patient is keep the pulse oximeter on the patient just so I can get his oxygen rates throughout the procedure. I wouldn't want it to drop and put the patient in danger, so I just want to have that clear so I can look at it. So what I'm going to do now is I'm going to place a towel across the patient to protect the patient's gown. And then I'm also going to set my suction between 100 to 150 on my suction regulator. Careful not to go over 180 though, because it could be dangerous for the patient. And I'm also going to set my oxygen at 100% FiO2 on my suction or oxygen flow meter and suction control. And these go hand in hand with just helping the patient's respiratory system be able to work better. So now I'm going to open my suction kit using sterile technique. And I'm going to remove my gloves and perform hand hygiene. Hand hygiene. So now I'm going to put on some sterile gloves. Alright, so now after I put on my clean gloves, I'm going to pick up my saline container. Right here, sterile saline. And I'm going to pick up the suction catheter. And then I'm going to put my sterile glove, or I'm going to put it on the flat surface and try not to contaminate it. Alright, so here's what I'm going to do. Put this down. And what I'm going to do is just pour this into here. Grabbing it by the label. And placing it down. So now what I'm going to do is I'm going to just put that down for right there. And then I'm going to put up my suction tubing. And I'm going to pick it up with my non-dominant hand. So that way I can and I'm going to put a large straw in it. So here's my straw. Here we go. So here's my straw. And this hand is now contaminated. So I'm going to put my catheter into the saline to lubricate it and simulate suctioning just a small amount of saline so I can get proper function. And I got it, proper function. And now I'm just going to remove my oxygen source. Which is the trach collar. And now I'm just going to apply my ambu bag. That's set at 100% FiO2. I'm going to put it in there, and I'm going to slowly hyperoxygenate my patient, administering 5 to 6 breaths over 30 seconds. Alright. So now, without applying suction, I'm going to gently insert my suction catheter into the trach. Being careful not to contaminate the catheter. by touching the patient gown and not touching the outer cannula, which is the bottom or the bottle realm. So what I want to make sure not to do is just touch the outside of the bottle, because that is contamination and could be bad. And once resistance is met or patient coughs, I'm going to pull the catheter back 1 centimeter. And then I'm just going to apply intermediate suction by placing and releasing my dominant thumb over the vent of the catheter. Slowly withdraw no longer than 15 seconds while rotating it back and forth. And it's okay for the patient to cough. I also need to be monitoring the patient's vital signs throughout the process. I broke sterility by touching the inner cannula. My inner cannula keeps coming out, so but I'm trying not to touch the edge of the bottle cap. So I will have to, one thing I would have to do is stop suctioning if there was a 20 beats per minute change, like an increase or a decrease in the pulse rate, or if the SpO2 falls below 90% or 5% from baseline. And I would have to repeat this procedure. But the most important thing is to allow at least 1 full minute between suction passes, making sure not to contaminate your thing by touching it. So what I'm gonna do is, after 2 passes, if the secretion is persistent, then we would allow the patient more time to rest and recover from the secretions. So right now I'm going to replace this, and I'm going to rinse the catheter. Hyperventilation. So again with this, here we go. Just twisting it and making sure suctioning, and make sure the patient coughs or so resistance is met. And just twisting and not going too deep in there. Just right. Here we go. And just making sure that the patient has that 1 minute pause between these. All right. So now I'm going to replace the trach collar. And I'm going to remove my sterile gloves, glove to glove and skin to skin. And now I'm going to perform hand hygiene and then apply clean gloves. So at this point, I would oscillate the lung sounds, and I would compare it to when we first started the respiratory assessment, or the first respiratory assessment we took before we started the tracheotomy care, to now after we have completed part of the tracheotomy care. So now what I'm going to do, wearing my clean gloves, I'm going to open my tracheotomy kit, moving this out the way. And pulling it away from me, open it up. So what I'm gonna do now is remove my sterile field. Which is how any pot is showing to me, so I'm gonna place that down. Put on some sterile gloves because I had to move my stuff out of the way. So now I'm just going to add what's in my basin to my sterile field, making sure it comes out. And then I'm going to add my basin and flip this over, get this out, and add it to my sterile field. So now it's all where I need it to be. And I'm going to put my sterile saline into all 3 compartments of my trach care kit. And we see that the expiration date, as checked before, that it just expires in December of 2022. So we're good. And I palmed the label while pouring. So now I'm going to remove my inner cannula. So here we go, and I'm going to remove my inner cannula. And now I'm going to move and put my tracheotomy back on it. Here we go. So now I'm going to put this in my sterile solution, and I'm going to get rid of my plain gloves. Do hand hygiene. There's all my clean gloves now. So I had to move my stuff out the way so I could place all my goods. Putting my gloves on. So now I'm going to take my brush. After organizing everything, I'm going to take my brush and I'm going to brush the inner lumen. And I'm also going to brush the outer lumen to be careful not to get the saline everywhere. Alright, so now I'm going to place into my second thing of solution, and I'm going to dry my inner cannula using a 4x4, and I'm going to make sure not to do it over my sterile field, that way I don't get solution everywhere. So here I'm going to take the pipe cleaners. And I'm just going to clean to dry it out. And I'm going to dispose of these. So now I'm going to replace my cannula, and I'm going to take off my tracheotomy collar, and I'm going to replace my inner cannula beginning at 9 o'clock and then ending at, and then going to 3 o'clock and then ending at 6 o'clock. And this will stabilize the faceplate for patient's comfort. And so what I did with moving from the 9 to 6 o'clock is that I was just securing it with the locking mechanism. So now what I'm going to do is I'm going to take my cotton swabs and I'm going to place them in my third solution. And now I'm going to clean. So I'm going to start with the stoma site. I'm going to break sterility and move my patient. So I'm going to start with the stoma site. Starting in and then moving out. Alright. And then on the other side. And now I'm going to clean my outside cannula, my outer cannula. Here we go. And now I'm going to use a gauze to lightly pat the skin dry. So now I would just observe the skin around the tracheal stoma, under the tracheotomy faceplate, and under the tracheal ties for any kind of skin breakdown, blistering, bruising, any kind of drainage or any kind of discoloration. And that could just let us to tell that if the straps have been done too tightly or anything like that. So now what I'm going to do is I'm going to replace my ties. Start by looping. And I'm going to keep my other ones on. Time the double knot. And now I'm going to take my scissors and cut the original one off. Alright, so I then disposed of the original one. And so now I will replace the oxygen therapy device. So I'm going to place this. Before I do that, I need to go ahead and apply my gauze. So around my tracheotomy collar. There we go. So I would compare my respiratory assessments before and after the tracheotomy care at this point. I would also perform oral care with a toothbrush or with the oral swabs with chlorhexidine rinse. And now I'm going to remove the drape. Remove my drape from my patient. Broke sterility. I wouldn't do that, but it dropped on the floor and I needed to dispose of my things. Those are my equipment. And now what I'm going to do is I'm going to raise my patient back to where he's comfortable. And the head needs to be elevated at least 30 degrees. I would raise my side rails. And then I would return my bed to the lowest position possible. I would then remove my gloves. And then my PPE equipment. So I remove my gloves, goggles, my gown, and then my mask. And then I would perform hand hygiene. And I would document my procedure, any kind of secretions, the characteristics of them, how the patient responded, the different respiratory assessments. And then I would also document trach care, the type, the size of the trach tube, the appearance of the stoma, and even the surrounding skin, if there was any kind of stop to the adventitious lung sounds, the nasal secretions, the gurgling, drooling that was seen beforehand, and we would just see if it had any effect.